How are you all?
All good, ready to go.
Carolina, do you want to start us off?
Yes, we're ready. Thank you, Javier. Please go ahead.
Okay, so
Thank you, James.
welcome everyone. I see there are still participants trickling in. Welcome to this virtual launch of the WHO PAHO Regional Oral Health Status Report. We greatly appreciate your interest and your commitment to oral health in the region and beyond. We have a high number of registrations from all countries of the region and from many countries outside of the region as well. We have put together a very interesting agenda today with speakers that cover different perspectives on the regional oral health data, the global situation, and also from the country level. This event is co-organized and co-hosted by the Pan American Health Organization in Washington, D.C., and the WHO Collaborating Center for Quality Improvement and Evidence-Based Dentistry at the College of Dentistry in New York, of New York University. Before we move on with the details of today's agenda, allow me quickly to introduce myself. My name is Habib Benzian. I'm the co-director of the WHO Collaborating Center at NYU. And I'm very pleased to inform you that today we have simultaneous interpretation for English and Spanish. To access those language options, you see at the bottom of your screen a little icon with a globe. Click on it, and then you will see the language options, and you can make your preferred choice. And remember, you can switch between the languages at any time during the webinar if you want to listen to another language. For questions and comments during the event, please use the Q&A box. We hope to have time towards the end to address a few of them. You will also get, as you can see, information in the chat box with links that are related to the presentations and the topics that we are discussing. I'm now handing over to my colleague, Dr. Beltran, who will continue in Spanish.
Buenas tardes. Muchas gracias, Dr. Benzian. Mi nombre es Eugenio Beltrán, soy co-director del Centro Colaborador de la OMS.
Thank you, Dr. Benzian. I'm Eugenio Beltrán from the University, co-director of the University of New York in oral health. And so the presentations will be in Spanish and English, and you have to choose the language of your preference by choosing the icon or clicking on the icon in the form of a globe in the lower part of your screen, and then you can choose the language of your preference. And today we will launch the Regional Oral Health Status Report. And we invite you to consult that publication. It is available in English through the internet, and it will be in Spanish. It will be available in Spanish in just a few days. So we will start with our agenda for today. Each panelist will have 10 minutes for his or her presentation, and I will tell them when we reach minute number 9 in order to be able to finish in time. And then we will have a very brief time for Q&As, and you can ask your questions on the Q&A space on the lower part of your screen. And we will do everything possible to answer most of or the greatest number of questions. And we will put on the chat also some papers, links to papers about the issues that we will deal with today. And thank you very much, and we will begin. Thank you, Eugenio.
Really participants from all around the world, which is wonderful. Great audience. Let me briefly introduce you to give you a quick overview of the agenda. We will start with opening remarks delivered by Dr. James Fitzgerald, who is PAHO's Director of Health Systems and Health Service Department. Following Dr. Fitzgerald, we will have a presentation to give you an overview of the findings from the Global Oral Health Status Report, because the regional report is related to the global report. This presentation will be given by Dr. Yuriko Harada, Technical Officer from WHO, on behalf of Dr. Benoit Varenne, the Dental Officer at WHO headquarters in Geneva. Afterwards, Dr. Carolina Romes, she's the focal point for oral health in the region and advisor for Healthy Life Course integrated approach, will present an overview of the findings from the regional oral health status report. Our next speakers are then the Chief Dental Officer of the Dominican Republic, Dr. Mario Mena, and his colleague, Dr. Seiter. And then we welcome the Chief Dental Officer of Chile, Dr. Carolina Mendoza. They will provide their country perspectives and the relevance of the report for their context. As Eugenio already mentioned in Spanish, a last word on timing. As moderators, we will have to be strict with all speakers today to ensure that we are keeping our time. So please bear with us in case we may need to remind the speaker of the agreed timing. So without further delay, I would like to give the floor to Dr. Fitzgerald for his intervention. Over to you, James, please.
Thank you very much, Habib. Very good afternoon to you and to all colleagues. Muy buenas tardes a todos que están conectados desde la región de las Américas.
Good morning to everybody from the Americas. It's a great pleasure to be with you today at this event that is very important for the PAHO.
The WHO regional report on oral health. I really want to take this opportunity to thank Habib and Eugene, Dr. Beltraz, also from New York University, WHO Collaboration Center, who I had the pleasure recently to meet at the UN General Assembly meetings in New York, and to participate actually in the launch of the global report in a very interactive discussion with you, with colleagues in New York, around really the urgent need to address this priority in public health in the region of the Americas as well as globally. I also want to acknowledge the presence of all the chief dental officers present here today, and the focal points from countries in the Americas and other experts in the field. It's a real pleasure to see so many people connected on this important issue. So colleagues, the Global Oral Health Action Plan was adopted in May 2023, and it really identifies public health challenges that are being faced by countries around the world in improving oral health. Our region is no exception. The Global Action Plan results from a tremendous, I think, effort to prioritize oral health across all WHO regions, and in particular in developing countries. It represents, I think, an important step in the implementation of both a resolution that has been adopted within the World Health Assembly, and of course the global strategy on oral health, which has emanated from it. And it's really grounded in this strategy, in the strategy's vision, its goal and its guiding principles, as well as the objectives of the strategy. And it really calls to attention the role of member states in developing the necessary policies, regulatory frameworks, the mechanisms and the financing that is actually required to ensure its implementation. In addition to that, it's very important to note that in this strategy, WHO and of course PAHO in the region of the Americas has an important role to play in facilitating the mobilization of countries and providing the technical support to countries in the implementation of this plan, and really mobilizing the partners, international that they are, national, civil society, private sector, to ensure its effective implementation. The overall vision of the plan is quite ambitious, and essentially states by 2030, 80% of the global population will have access to essential, quality, and affordable oral health services. The action areas of this plan then include 6 strategic objectives that we'll present for you a little bit later on, requiring really public health interventions, but more so population-based approaches in its implementation to ensure that we're really reaching the populations that need to be covered, that need to have access to these critical services, including populations living in conditions of vulnerability, children, women, adolescents, adults, older persons living in areas that face important challenges and important barriers to access services. It recognizes that oral health is fundamental to health and well-being of people, and that the health systems that we are developing in the Americas need to essentially integrate oral health services, regardless of the economic conditions in which are being faced by a given country. In order to achieve this, then, we need to have essential reference frameworks. We need to be able to identify needs, to develop national plans, to resource those plans, and to ensure effective implementation. And so the implementation really is at all levels. It's from the policy framework level, it's from the regulatory level, it's from the identification of gaps, the organization of services, the allocation of resources, and the construction of the necessary programs to affect outcomes. One of the key areas I think that's very important to mention is around the aspect of coverage and access. It really calls on the expansion of coverage of oral health services globally and of course in the Americas. And as I mentioned previously, to break down those barriers that impede access to that coverage. And so we're not just talking about coverage, but really access to the services that are required. Finally, as you know, oral disease, despite being largely preventable, remains a major public health issue across the Americas. We have extremely high prevalence and unfortunately significant negative impact of oral disease on individual persons, family, community health. It impacts around 470 million people in the Americas. Most of this disease is essentially preventable. Of course, as we see in many other areas, inequalities mirror access to services and the prevalence of disease. And so we really need to be able to shift and address those inequities that persist in access to oral services within our health systems, within our communities. And so our actions will be very much focused on that, to really begin to expand coverage of these services, looking at specific populations that are particularly in conditions of vulnerability, and within the framework of the global oral health strategy, to really address the burden of leading oral diseases in the Americas. We do face important challenges. We need to position this at an important political level within the public health agenda in the Americas and ensure that countries assign the necessary resources for its effective implementation by 2030. So with that, I think these are really my opening remarks. I think we have a wonderful opportunity to move forward in the implementation of cost-effective interventions at the local, subnational, and national level to really scale capacity in this area and to make sure that oral health is not just seen as a marginal service that is only available to those that can afford it, but it is really incorporated and integrated to the comprehensive packages of services that need to be made available for all people, irrespective of where they live. And so this is our intention. We really do look forward to working with you following the presentation of the report and building these programs regionally. Finally, thanks again to New York University. Thanks also to Carolina, who's working and leading this work at PAHO. We really also, Habib, Eugenio, look forward to continuing working with you, and of course, all our partners and all our member states that are present here today. Thank you very much.
Thank you, Dr. Fitzgerald. Normally we would give a round of applause, and I assume that everyone who is listening will give this virtual round of applause. Thank you for placing things so nicely into context. And it's great to see and to listen to you and to witness the strong commitment of PAHO to oral health and an integrated agenda that is guided by the global policies. Very, very welcome. Thank you very much. I'm handing over now to Dr. Yuriko Harada from WHO headquarters in Geneva. Over to you, Yuriko.
Thank you, Habib. May I confirm if you can see my screen?
Perfectly.
Okay, good. So thank you so much. And hello, everyone. My name is Yuriko Harada. I am a technical officer at the WHO Oral Health Program based in Geneva, Switzerland. It is my pleasure to provide an overview of the Global Oral Health Status Report, which was published last November. So I'd like to start with the exciting global momentum on oral health that we observed in the past 3 years. It started with the adoption of the resolution on oral health in 2021 during the World Health Assembly. This resolution on oral health clearly asks for the shift from the traditional curative approach on oral health towards prevention and promotional approach on oral health. And as you can see in the photo, Director General of WHO, Dr. Tedros, he mentioned that oral health has been overlooked for too long in the global health agenda. And this new resolution on oral health provides a welcome opportunity to place oral health as part of the NCD and UHC agenda. So following the mandate given by the member states to WHO through the resolution, we developed the global strategy on oral health, which was further adopted in 2022. There are 6 strategic objectives, such as oral health governance, oral health promotion and disease prevention, health workforce, oral health care, and oral health information system and research agendas. Furthermore, we translated this global strategy on oral health into a global oral health action plan. There are 11 global targets to be achieved by 2030. I will share the link afterwards, and you will be able to see that there are 100 actions listed for countries, for WHO, international partners, civil society, and private sectors. It may be difficult or not possible to act on all 100 items, but what we are expecting for countries is to take a look at these 100 actions listed and to do the prioritization exercise based on their country context as well as the disease burden. So the Global Oral Health Status Report was the first step for WHO to implement the resolution on oral health. What is unique about this Global Oral Health Status Report was we developed the first ever country profile for all 194 member states. So I provide the example of the country profile of the United States of America. And in case you haven't taken a look, you can go to WHO website and download the country profile of your country. In this country profile, we have estimation available for oral disease burden, such as prevalence of dental caries, periodontal disease, edentulism, as well as oral cancer. There are also information available for the risk factors, which are shared with other NCDs, including sugar consumption, tobacco use, as well as the alcohol consumption. There are information available for the economic impact as well as the national health system response. If you go to the second page of the country profile, you'll be able to see the data source where we collected and used the data from. And what we are expecting for countries is to take a look at this country profile and use this information as a baseline data in case it is applicable and needed for countries. So in the Global Oral Health Status Report, we provide a new definition on oral health. And I will not read everything, but what we wanted to emphasize is oral health is beyond the health of mouth or beyond the health of teeth. It enables individuals to perform essential functions, such as eating, breathing, speaking, and including other psychosocial dimensions. So with this broader new definition on oral health, We hope that country can move or shift from the traditional silo approach on oral health towards more comprehensive and more integrated approach on oral health. So the Global Oral Health Status Report emphasized that the global disease burden is quite alarming. What we got to understand is half of the world population, 3.5 billion people globally, are affected by oral diseases. And majority of them, they live in low and middle income countries. So as I explained, oral diseases are part of non-communicable diseases. And when we compare the case number of oral diseases and other non-communicable diseases, such as mental disorder, cardiovascular disease, and diabetes, the case number for oral diseases is much higher than other NCDs. And what I want to emphasize here further is when we compare other NCDs case number all together, still the burden of oral diseases or case number of oral diseases is higher than the other NCDs combined. So you see that the burden is quite high, but it has been neglected for a long time, unfortunately. So this is the end of my presentation. And what I wanted to emphasize is now we have exciting global momentum on oral health, started from the resolution on oral health, following the adoption of the global strategy, as well as the action plan on oral health. WHO developed the Global Oral Health Status Report, which was published last year, including the country profile, which we hope that this will serve as a baseline information for countries. And now we are translating this global report into a regional publication. And we have done so for other regional offices or other WHO regions already. So I think it's a time to really take actions from the global exciting momentum to the regional level as well as country level. And we hope that this new publication, which is the regional summary for Americas, will serve for this purpose. So this is the end of my presentation, and I hand over back to Habib. Thank you.
Thank you, Yuriko. Thank you so much for highlighting those key findings and for putting it into perspective that the reports, the status reports, are really part of a bigger suite of documents, including the global policies to help improve momentum and attention to oral health. With this, I'm handing over right away to Carolina Holmes for the regional report details. Please, Carolina.
Thank you, Habib. Gracias. Gracias, Yuriko.
Thank you, Habib. Thank you, Yuriko, for your presentation. It's a very complete presentation, and thank you for being with us today. And at this meeting about the report of WHO and PAHO about oral health. The one for our region is based on the global one published by WHO and also by PAHO. And this regarding the specific report for our region. So these are great opportunities to make progress in oral health. I'm Dr. Carolina Holmes, regional advisor. So to start this presentation, we need to focus on some data that we have to deal with. One of them is that the oral diseases are among the most common non-communicable diseases at world level. And the demographic transition is creating a greater demand for care. And in the Americas, the oral diseases affect almost 50% of the population, and the cost of services for oral health is still increasing. So people renounce to their care. And we have great inequalities also in rural health. In the region of the Americas, the direct expenses due to oral health are very high. It's the highest expenditure rate among the regions of the WHO. In May 2021, if you remember that, during the World Assembly of the WHO, a resolution was adopted for oral health until 2030. This resolution that was approved in 2021 is very important for the implementation of the global agenda and for the plan of action on oral health in different countries. And so we will develop actions based on cost-efficient measures to face oral health issues and also the inequalities present both in service and in the communities. So the objective of the global strategy is to orient member states, to guide member states towards developing national responses to this problem and increase their budgets in order to achieve a universal coverage of health and thereby contribute to the make the different data on oral health more positive. And this effort should not only focus on delivering service in this area, but they should also take into account broader issues such as social or commercial determinants, lifestyles, and the problems centered in the communities and in the persons that will allow us to face systemic pathologies and endemic issues. Oral health is part of the basis of general health. So a better oral health leads to a better general health. So we have to guarantee the availability of comprehensive health services and integrating as an essential component oral health. And this means that we need a first care level that it should include oral health and should be integrated in the network of health services. So we need professionals that are duly trained that could respond to the needs or the particular needs of the population. We have to plan the resources and also the labor force that should be aligned with these needs and the objectives of public health and the complex problems of the population, especially the population that is left aside usually. Well, we have to take care of a person as a whole, and oral health is part of it. We have to take into account the context and the family in which that person lives. And we have to take into account artificial intelligence, etc., that could be used as tools for public health and also for oral health in order to improve the knowledge in this area and thereby also offering teledirected services. Regarding the Agenda 2030 for sustainable development, we now have a new opportunity to leave nobody behind, also in oral health. And the Plan of Action 2018-2030 for sustainable health in the Americas also includes that. Oral health should be included in this framework of sustainable development in order to achieve universal health. General health and oral health go hand in hand, not only to prevent oral diseases, but also preventive action that is much more effective. And the member states should be should define these points of entry in order to generate an impact not only at national but also at regional level. The political declaration of the high-level meeting, so the representatives meet and set up a declaration that is quite significant, and it should help us to accelerate progress towards universal health for 2030. It also changes the way in which we look at health. It's a resource and a capacity that is built even in the presence of disease. So oral health measures should articulate with other measures in order to build health assets that are centered on the person. And well, education is very important also in that sense. Some of opportunities for the countries of the region of the Americas and Caribbean. There are many, but I wanted to highlight the ones that are in the report. We have to develop new national policies for oral health aligned with the world strategy, to assign the staff and funds necessary to this end, to adhere to the Convention of Minamata on mercury, and to accelerate the implementation of measures in order to gradually reduce the use of mercury in this sense. The incorporation of dental paste with fluor all on all these dental paste, and to optimize the digital technologies for oral health, to integrate oral health in the primary health care at all levels of service, including the necessary staff and competences, and also to develop a model of labor force that is innovative, so that oral health services respond to the needs of the population. The challenges are also numerous, but they are not impossible to overcome. There are countries that do not have a policy or national strategy on oral health. There is a lack of staff for these services, and there are great inequalities according to the level of income. The models are mostly private for dental health or for oral health, and so it is a great expenditure for the people that do not have a high income. And so, and primary healthcare is still fragmented, and in some areas it's non-existent. So it's also possible through the networks for primary healthcare. It is possible to include oral health. Oral health should be included at all three levels, from primary care to specialized care. The integration should also be part of including these diseases at all levels of age and from the beginning to the end of human life. And in order to build good health in our populations, we have to take into account the course of life, because this is a better way to design primary health care. So there are 4 tools here that allow us to carry out these programs. Among them, the optimization of health trajectories, the multidimensional focus, the preparation of prevention of comprehensive prevention of diseases, and the promotions of the agencies of individuals, families, and communication. So these determining factors is very important, especially acting at the three levels: persons, individuals, families, and communities. So here I end my presentation and I hand over the floor to
Thank you,
Habib.
Dr. Gomez. This is a very comprehensive overview of the place of oral health in the bigger picture of our global policies and the life course approach, all very important notions and a lot of information in a very short period of time. Thank you so much. We're moving on. We are slightly behind time, but that should be fine. Just a little word to the colleagues who have posted questions. We will try to get to these questions towards the end of the seminar. So we will not respond directly in the chat, all of them. So I'm handing over now with pleasure to the Chief Dental Officer from the Dominican Republic, Dr. Mario Burginal Mena. The floor is yours.
Muy buenas tardes. Mi nombre es
Good
Mario.
afternoon. My name is Mario Bonigan, and I'm in charge of dental services in the Dominican Republic. Our country shares an island with Haiti. We have a territory of 48,000 square kilometers and a population of about 11 million inhabitants. Our population has a coverage of health problems of 98%. I would like to give you some data before providing you the data about oral health in the Dominican Republic. In 1986, we developed one of the most revolutionary programs at that time with the support of WHO and PAHO through the training of human resources for oral health. I will tell you about some of these activities. We set up a research unit and did a census of our population regarding oral health with some indicators in order to get a diagnosis. We wanted to know about the situation. We wanted to decrease the presence of caries with dental paste, including fluor, and correct teeth brushing. So we started with a prevention program in the whole Republic through adding fluor to water. And this includes several areas, almost all areas in the country. Starting in 1981, during the meeting of PAHO, determined that the member countries should take into account the plan of action for the regional strategies and the document presented by the government of the Dominican Republic regarding the incorporation of oral health into the strategies of primary care. In 2000, we again have a change of government, and we started to extend these services in order to reach all the population in the country. At that time, our president issued a decree that all the salt used for human consumption should contain fluor in order to prevent caries. And the schools should offer dental services for all children. In 2004, the government changes, and we went backwards in all these measures. But presently, right now, with a new government, we started to develop activities focused on priority groups, that is children, pregnant women, and it is a totally free of charge service. And we have considered, we have put into action a plan for communities that are free of caries, and the dental services are totally free in these communities. And we also supervise the teeth brushing in all schools in our country. Today, on October 26 at 10 o'clock in the morning, we started this campaign supervising the teeth brushing by our children and including the parents so that they see how important it is to brush your teeth correctly. So every 26th of October, it has been declared the day for good teeth brushing and will take place every year. And for example, we also include the oral problems of all adults. We have launched a program called Regenerating or Restoring Smiles, and we have developed and created prostheses for 500 persons of among the elderly, and we have also the odontological journeys. When we arrive at the communities, we examine all patients, but we only count as a success those patients that have the problem solved. For example, on the third day, we are going to a city that is on the border to Haiti, and we will also start these actions. And we also do trainings for the management of dental health, of oral health in pregnant women, and also the odontological care for hemophilic patients and urgencies. We are also training our patients regarding these urgent situations of oral health. For example, sometimes when there is a small trauma, we have to, and sometimes the dentists at the community services are not prepared to deal with these issues. Now we have developed an important activity that is the management of urgent situations, emergency situations of oral health. In this government of change by under President Luis Abinader, we took the first steps for ontological autonomy. 3 months ago, this decree was issued, Decree 317, that launched the national program for oral health, and that is declared of high national interest, and we started to implement the program. Here you can see our president on a visit to our different facilities, and so we are known as a government and a country that prioritizes oral health. Here, the president is meeting with the president, with the chair of WHO, and there are a series of recommendations that we want to tell you about. To carry out this program, we need the technical and financial support of PAHO and WHO. We should include fluor in salt. We should enlarge the cover of our population and the services for oral health. We should have special care programs for the elderly. And I want to also share the words of our president with you. During a press conference, he talked about oral health problems, and this is what he was saying. I'm sorry, I can't hear him.
Seems we cannot hear, we were not able to hear what the president was saying. Maybe you can repeat briefly what he was saying?
No sé si escuchar lo que dijo el presidente.
No.
Si lo podía repetir nuevamente, lo que
Sí. Claro.
Claro. Lo que dijo el presidente, con sus palabras, diga lo que dijo el presidente.
Nuestro presidente lo que
Our
informa
president, what our president said was that starting this year, odontology would be autonomous as a service, and that the government will set a budget that is solely focused on oral health. Thank you very much.
Wonderful. That was worth repeating and sharing with us. Thank you so much for this big historical overview and the current situation, for sharing the current situation in the Dominican Republic. Congratulations on all your ambitious plans and good luck with it. I'm pleased to hand over now to the Chief Dental Officer from Chile, Dr. Mendoza. You have the floor, please.
Muy buenas
Yeah,
tardes.
we can see your slides. Thank you.
Sí, sí podemos ver sus diapositivas.
Gracias por esta invitación y por la
Thank you very much for
oportunidad de
this invitation
compartir
and
con
for the
ustedes la
opportunity
experiencia de
of
Chile
sharing
en
with you the
el
Chilean
desarrollo de los planes
experience in the
nacionales de
development of the
oral health
National
en la
Plan
Agenda
for
Mundial
Oral
Dual
Health
liderada
within the
por la Unión
context
Europea.
of the world
Como
agenda
ya se
that
mencionó
is
por
led
primera
by
vez,
PAHO
el
and
informe sobre la
WHO.
situación mundial de
This
salud
report, as was mentioned,
pone de manifiesto el
shows us
mayor
that
desafío que enfrentamos,
we are
la
facing
alta
a
prevalencia en enfermedades
very
bucales que se
huge
distribuyen de manera
challenge
desigual y
because
afectan la
oral
calidad de vida de
health
las
and
personas.
oral health services are
En
distributed
Chile, el escenario es muy
unequally,
las
and in
calificaciones
Chile,
continúan
um,
siendo un
the
problema de salud
the
pública. Cabe
panorama is the
destacar
same.
que la salud bucal fue
Caries are
para las
still a
políticas de
public
salud.
health
Nosotros
problem,
tenemos un
although
53% de
oral
niños y
health
niñas de
is
6
part
años que
of
atienden en los
the
centros de atención
national health
primaria
program.
que tiene que
And we
tener
do
salud
have,
bucal.
but
En
we
los
do have a high
departamentos rurales,
percentage of
la
children
prevalencia
between
asciende
6
hasta
and 10,
61%.
and it grows to
En el campo de salud bucal,
61% among
estas
teenagers. And
reflejan las
regarding
desigualdades que
adults,
hablábamos.
we see the
En
inequalities
relación a
that
las
we
lesiones de
were
caries
mentioning
dentales,
regarding
vemos que más del
cavitated
74%
caries.
de la
More
población
than
mayor de edad tiene lesiones
74% of
cavitadas que requieren
the
tratamiento.
population above
Esta
15
prevalencia es
have
mayor a medida que avanza la
caries that
edad
need to be
en
tended
personas
to,
con menos años de
and
estudio y en personas que viven en zonas
this is more
marginadas.
prevalent in rural areas
En
and
cuanto a
in
los enfoques de
persons in the
territorialidad
population
de
with a
salud
lower degree of
funcional,
education.
la situación en
And
Chile es que
regarding
cerca del 70%
the
de las personas entre 35 y
non-functional
74 años
teeth,
tienen menos de 20 años.
teeth among
Y esta
the
prevalencia es mayor
population,
en personas
we
con
have a
menos años de
higher
estudio
prevalence
y que viven en zonas
among
rurales.
people with less years of studies
Los
and that
desafíos
live in
actuales
rural
de la salud
areas.
bucal de
You
las
see the
personas,
percentages here.
menos de la mitad de la
Regarding the
población
perception
considera
of
que la
oral
salud
health,
bucal es muy
less
buena en
than
Chile.
half of the population
Las
considers his or
expectativas
her
de
oral
vida en
health
las
very
personas
good.
jóvenes
This
y es más
perception
grande
is
entre la
higher
promedia
in
de edad
young
en
people,
personas
and
con menos años de estudio y que viven
it
en las
goes
zonas
down
rurales.
among adults of during later years,
A
and
pesar de que
especially in
PAHO
rural
tiene
areas and
oportunidades para investigar
persons
y
of
prevenir
lower
enfermedades
degrees of
hereditarias y
education.
neuroprevenibles.
So, well,
La Agenda
there is a
Mundial sobre Salud Bucal nos
plan of
ofrece una
action
oportunidad y herramientas para
developed about oral
la
health
estrategia mundial nos
at
crea
world level.
elaborar
The world
propuestas
strategy
ambiciosas para
tells us that we have to find ambitious proposals to deal with these oral problems and include them in universal health plans up to 2030. And so we were offered a series of strategies that we should implement in different contexts based on evidence, and also a framework for monitoring the different indicators that will allow us to measure success. In Chile, we have faced this challenge through the National Plan of Oral Health 2021 to 2030. The objective is to improve the state of oral health among the population. It's a participatory plan with actors at different levels of the country, and it lies within the framework of all health objectives until 2030, which is in agreement with the goals of sustainable development. And they are part of axis number 3 among non-communicable diseases, and we expect three results for 2030, that is, habits promoting oral health associated to lower consumption of tobacco and alcohol and sugar. And then the result number 2 is to promote the adequate hygiene and also to promote better oral health according to 6 strategic lines, including the promotion of health and prevention of oral diseases, the provision of ontological services, the development of human resources, and financing, and also research, monitoring, and evaluation. This leads us to different levels of intervention, of course, and many of these strategies are already being applied, and I would like to mention some of them that contribute to reaching the objectives we have developed. For example, the program about developing smiles, about seeding smiles. And so this is for small children, and it promotes the brushing of teeth with fluor dental paste. And this is part of the primary healthcare strategies that offers ontological care to all people according to the requirements of their age. And so it is based on a family and community focus. With regard to mercury containing dental implants, we see that nowadays only 1% of all dental services, including implants, now are based on amalgam, on mercury based amalgams. And regarding the adding of fluor to drinking water, this means that 75% of the population has now access to water containing fluor. And we have comprehensive policies, such as, for example, the food guides for Chile. They insist on consuming water and not sugared sodas. And it also it also focuses on the prevention of the consumption of high sugar foods. And also there's also the prevention of smoking and alcohol consumption. Although we have important progress, we still have some challenges ahead. The first one is to continue with the national plan as a roadmap for all issues that involve oral health, which means that we can develop comprehensive and long-term strategy. We also want to reinforce the strategies for the prevention of oral diseases and to increase the advantages that we have reached in children. We wanted to integrate oral health within chronic disease management. And we want to carry out a monitoring of indicators and goals at the different levels in order to set up a strategic plan to improve vigilance and taking care of risk factors along life. And finally, and not less important, there is also the challenge of participating in international spaces of discussion and cooperation in order to provide help to each other in this sense. Thank you very much.
Thank you so much, Dr. Mendoza. At least the last
Gracias.
you have already achieved for today by participating in this international event. And also you were participating in November in the global launch of the report in Geneva. So thank you so much for all of this.
Muchas gracias.
I'm handing over now the moderation to my colleague, Eugenio, to address a few questions. You are muted, Eugenio.
I'm sorry. I think we have 1 or 2 minutes for a couple of questions from the audience, from participants. And I would like to pose to anybody in the audience who wants to answer. I'm going to choose one question, and we'll start with that. And it's, good morning. We would like to know what are the plans prepared on oral health to work on school settings. Do we have any indicators or any measurements or experiences on those experiences and those approaches? Anybody? And that includes you, Dr. Benson.
Carolina, do you want to say something? Otherwise, I can chip in. Sure, Dr. Mario, please.
La experiencia que tenemos en las escuelas. Sí. Nosotros tenemos experiencia en las escuelas.
We have very good experiences in school. We talk about carriers-free schools where we deal with all oral problems of our children. And we also engage in prevention. And we have about 35 schools totally free of caries through the daily teeth brushing in these schools. And we want to extend this campaign to national level, although this is, of course, involves very high costs. And the idea is to keep our children always healthy. And I believe that this year we will be able to reach almost 70% of all school children in the Dominican Republic.
Thank you. Gracias. I have a second and final question. What is Pan American Health Organization is doing on oral health of these adults and senior adults?
Actualmente, ese es un área que está, si me permiten contestar, muy importante para nosotros en OPS. Estamos trabajando en colaboración.
This is a very important area for us at PAHO. We are working together with WHO on this in this initiative, and there are pathways to deal or to attend to the needs of the elderly. There were some guidelines for primary health care workers, and this initiative was in charge of our predecessor. This policy was called CEFAR, and it was divided by 3 groups of age, and we weren't able to set up the module for the elderly yet, but we are focusing on that because we have to take them into account as a priority group.
This is related with whether we're going to have some sort of a monitoring system, an evaluation for the oral health, the impacts of the activities related with the program. And I wanted to answer saying that yes, there will be some guidelines on indicators and how to monitor those indicators. They're already available for your comments and evaluation. And we would like to hear the feedback from you in the field among the suitability of those indicators. So I think that we are moving in that direction. And with that, I just want to close the meeting. Voy a cerrar la sesión hablando en el idioma de Cervantes. Quiero
I will
agradecer a
close the meeting speaking in the language of Cervantes. I want to thank all of you that because you adjusted your interventions to the time allotted, and we hope that we can continue working together and exchanging ideas and combining our efforts to implement the action plan and reach positive results in 2030. I believe that there are many countries in the region that have stories to share with other countries. So welcome to the new stage of communication with all of you. Thank you very much, and we see you soon, and we are always at your disposal. Thank you very much.
Gracias a ustedes por la iniciativa.
Thanks to you for this initiative.
Very good.